RIIO, as the Rwanda International Institute of Ophthalmology, started in 2011. And it was the institute that brought in Rwanda the first specialized hospital, Dr. Agarwal's Eye Hospital. That was in 2012. So our aim was to bring to Rwanda the best of eye care, to make sure every aspect of eye health can be covered locally. So we worked with that hospital for about 10 years. But in the meantime, we started the training program. That was our main aim, to work with them, because to support the training of specialists in Rwanda. Because we had that gap. We didn't have, when we started in 2011, Rwanda had only 8 ophthalmologists for a population of about 11 million then. So we saw the gap. We thought trying to start our own training program will make sure we get the quality we want, and we can train the people who we think can make a difference, both for Rwanda and for the other countries around us, hence the name International. So we worked as a hospital first, then later on we started the training program in 2018. We've already graduated 6 ophthalmologists who are now working in different hospitals in the country. But we'll come back to the school later on. But the hospital, we started this hospital in 2023. Just after COVID, we decided to have a standalone super specialty hospital where every aspect of eye health can be truly covered. So we started with 4 ophthalmologists. Now we have a group of 5 ophthalmologists with different super specialties within ophthalmology. So when you reach our hospital, the first step for us is to examine you in a comprehensive way. So we examine all parts of the eye, then we'll find where the problem is. At that point, you might be treated by any ophthalmologist because it's a minor issue. But if we find now that you have a problem which needs a super specialty level of care, we'll then refer you to the person who is more specialized in that area. For example, if you come on day 1 as a first visit, you can see any doctor who is around. But that doctor first has a general knowledge in ophthalmology. He'll examine you and say, because you are diabetic, for example, we see some bleeding in your retina, we see some what we call edema in your retina. Therefore, we are going to give you to the retina specialist who is going to explore more and tell you more about your problems, and will tell you how best to manage your case. So that is what we offer. It is those super specialty clinics. So you might come to me, but I refer you to now the retina specialist if you have a retina problem. Or you can come and the doctor who sees you will tell you, you actually need a cornea transplant. Then they send you to me. I'm going to explore and tell you the different options. And if you need a transplant, I'll tell you how we do it, the chances of success. And then somebody will tell you, of course, about the cost. But for me, I'll tell you the different technical aspects of how we manage cornea problem up to the level of transplant. Ophthalmology is also one of the areas of health where we use a lot of technology. And the technology changes almost every year. So when we talk about imaging of the eye problems, we have different machines which will image different parts of the eye. So if you have a retina problem, we'll have something that we can compare to the MRI in the general body. We have those for eyes. So we started producing what we call a national strategic plan for eye health in 2001. Every 5 years we revise it. Sometimes it gets shelved because there is no money to cover all the areas of the plan. But we've been working with the Ministry of Health since that time. Now it is fully integrated. We have a new plan which is ending this year, we are in the process of drafting a new one for the next 5 years. So we are very well organized as the eye health providers. We are the first country in 2011 to start what we call a primary eye care program, where every health center in the country had a nurse trained to cater for eye problems within the communities. In 2004, we also started the training of what we call mid-level eye care workers at the school called KHI then. We started the program in 2004. I was the first head of department. And our aim was to make sure we have cadres who can look after eyes in all district hospitals. So we started with the secondary level, then we went to primary in 2011, and in 2018 we went tertiary, now training the specialists. So the journey has been very smooth, I would say. We work very closely with the Ministry of Health and its partners. There are many partners who are supporting the ministry to make sure eye health is available and affordable, and we cover the whole country. So when we talk about universal health coverage, eye health comes, I think, at the front. So we are now in a good place. We have moved from 3 ophthalmologists in 2001 to about 8 in 2011. Now we have 28. The main challenges we find, especially in the public sector, because I also work in the public. I work at the Rwanda Military Hospital as an officer. So we have a problem of procurement. That is a serious problem because eyes being a very small area relative to the rest of the body, we don't have a supplier of many items in the country. So most of the things we use are directly imported by the providers themselves. So if I need to change the bulb of this machine, I have to import the bulb from Japan. So that is a big challenge. The second challenge is we don't have specialized biomedical engineers who can service this machine. And yet we rely so much on technology in ophthalmology. So the few engineers we have are general engineers who are not specialized specifically in eye equipment, and that can be a challenge. A small issue can block the whole department. A small bulb can block you from operating because the operating microscope cannot work. So that is a big challenge. So maintenance, procurement, and the costs, the tariffs are quite low. That will discourage some of the international players who would like to invest in Rwanda because of that. But unless you have subsidies from different NGOs, for example, it's difficult to afford the cost of what we give as services.
My name is Professor Shiko Mathenge, and I am an ophthalmologist. I'm also the program director at this School of Ophthalmology. It's the Rwanda International Institute of Ophthalmology, and we train doctors to become eye specialists. This is a school to train specialists, so it's not a traditional school like other schools. We offer only one main course, which is we are training doctors to become ophthalmologists. It's a 4-year program, and we've been doing this for the last 6 years. We started with 4 students, 4 young Rwandan doctors who completed their training 2 years ago and are already posted to work in districts in Rwanda which didn't have eye doctors before. Right now I have 13 other students in session, and among those 13 we have doctors from Kenya, from Burundi, from Congo, and from the Bahamas, as well as Rwandans. So we are at a stage where we're beginning to receive a lot of applications from other African countries and even beyond Africa. So we train under the College of Ophthalmology of East Central and Southern Africa. So that is the body that gives our trainees a certification that allows them to be licensed as eye specialists, no matter what country they come from. We are very lucky in that our trainees are in high demand. So when they're in the last 6 months of training, already employers are asking us, when are they graduating, when are they graduating, which is good for them, and also good for us because it puts pressure on us to make sure we graduate them ready to hit the ground running. And we are very proud of the 6 that we have graduated so far. We have one working in Rwamagana, one in Ruhengeri, one in Kibuye, one at Kibagabaga, and 2 at Kabgayi Eye Hospital. And when they are brought to us by the Ministry of Health, then the Ministry of Health is the one that posts them. And literally, as soon as they finish, the job market is ready for them. The others will go back to their countries and they will get employed by the Ministry of Health there. The course takes 4 years because we are training specialists, and we have to train them both in treating eye diseases by sitting in a clinic as well as performing surgery for many eye conditions. So because it is a surgical training, it is microsurgery, it's very intensive, and that's why it takes 4 years. So RIIO is an interesting program because when we started, we were offering a model that is unknown. Most places in Africa, when you want to train as a specialist, you go back and join the university and you do a master's program, either to be a pediatrician or to become a surgeon. And we wanted to try a different model where it's not a university program that's like 3 years or 4 years, but where we were taking the time to give you competencies, and you only graduate when you have acquired all those competencies. And we felt that would be difficult to do under a very structured university program. We wanted some flexibility. And a college way of training gives you that flexibility where you graduate because you're ready to go and work, not because 3 years are over and you've passed some written exams. So it was a bit of a strange model. Many people didn't understand it, and preparing to start this school took a lot. It took about 5 years to get ready because you want to make sure when your trainees graduate that there's somebody who can employ them, that they can be licensed as specialists. And we wanted to do that not just for Rwanda, but for the region. So we started off by going to the medical councils and telling them this is the program we want to deliver. When this doctor graduates, will they be able to get a license as a specialist? We also needed a credible body to certify us as giving them the right training. So the College of Ophthalmology was the perfect college for us. And in fact, when we started, we offered our candidates international exams from the International Council of Ophthalmology, which is an exam recognized all over the world. So because it was unusual, it was difficult, but we wanted to create something that produced an eye doctor that was really ready for the market. And now we really had no problem with the 6 that we've graduated. They are all employed and licensed, and our foreign students have also started like the process of getting ready to go back home, and we know that they will have no problem. So that is how we do it. All Rwandans that we train are sent to us by the Ministry of Health. That means that the Ministry of Health gives them study leave and keeps them on salary as they train with us. And we as an institution look for scholarships for them because somebody needs to pay for them being here, because we are private. We have to pay rent for this facility that you see. We have to pay the staff who work for us. So it actually takes, we end up being a little bit more expensive than other trainings, and yet maybe our doctors are paid the least because we are all relying on these school fees that these trainees pay. But all our trainees are on scholarship, and we are the ones who look for those scholarships for them. The story of blindness and the shortage of eye workers is the same in almost all countries of Africa. We have an acute shortage of eye specialists. For some reason, ophthalmology is not popular in Africa, while it's the most difficult specialty to get into in other parts of the world. We hope, institutions like RIIO will change that. So when we started, we had only 4 applicants, Last year we had 70 applicants, so it shows you at least the profession is becoming more popular. When we graduated our first 4 students, we increased the number of eye specialists in Rwanda by 30%. Yeah, so it shows you how few we were, and we still are. So now we've put 6 into the market, that we've added 6 into a pool that had about 15. So having an institution locally really does make a difference, because until last year, every eye doctor in Rwanda was trained in another country. And then bringing up the numbers becomes really difficult. But now by the time we graduate, this 14 who are in session, we'll have doubled the number of eye specialists in Rwanda. We have a lot of causes of blindness that are what we call avoidable blindness. Avoidable because it can be treated or it could have been prevented in the first place. In order to do that, we need these specialists in the right place. In the right place means accessible by communities. So nobody should have to leave Nyaruguru or Nyamasheke to have to come to Kigali for a simple eye test. And when we get specialists out into the districts, we are bringing the services closer to the community, and that will help to end this avoidable blindness. Our challenges are related to our lack of resources. So we now have, our capacity is 14 students. You heard we have 13. That capacity is determined by access to clinics where we train these doctors, because to train doctors you need a high turnover of patients. We are very grateful to Kibagabaga District Hospital, which has allowed us to create a good training eye clinic there, and which gives us all the support we need. So a good training hospital is a challenge. The other one is just space, because to have more students you need more space. To have more space, square meters in Kigali cost a lot, and if we are to afford more space, we would have to charge more fees, and yet our students come from backgrounds that it's difficult for them to pay more than they're paying now. So I guess maybe one day we'll have some external support to add to what we try and get for ourselves. But honestly, training specialists cannot be a private thing. It needs to be something that's supported by government or Ministry of Health or Ministry of Education. It's a heavy burden on individuals. My vision is that we can grow beyond RIIO, or RIIO can become part of a bigger body that allows it to flourish and become better than it is. My vision is to have really the best talent coming to RIIO as faculty, and we have very good faculty. I hope you'll get to meet them today, who are really leaders in their specialty areas. And my vision also is that each one of our graduates, wherever they are posted, will really make a difference.